Okay, so what we're gonna do is we're gonna mobilize the hip joint capsule into internal rotation. We're gonna find that end range position. I'm gonna have you spend a prescribed amount of time just kind of stretching into that end range. Then we're gonna hit a few rounds of 2 isometric contractions at end range. What that does is it starts kind of telling our brain this is a range of motion we want to be able to access. So we need to do a little active work, which we're going to do via these isometrics. So you're going to have a seat on a bench, and then what we're going to do is I'm going to show you on this leg. You're going to bring your feet and knees wider than hip distance, and then for the leg we're mobilizing, you're going to let that knee drop down. Now, as you do this, if your body's going to try to offload and kind of move out of this stretch, what you're going to feel is your body weight kind of shift off of this glute. You may even start to kind of rotate away. So what you're going to do is really anchor that glute down, and then your pelvic bones, I want you to really pull back into this side of the pelvis. This other side will kind of move forward so that you're almost a little bit rotated towards this hip, but that rotation's not coming from the spine, it's coming from the pelvis pulling back on this side. So again, make sure you've got kind of all those levers winded up here, and then once we've kind of find our end range, I go ahead and throw my hand here for a little overpressure. If the inside of your knee is feeling torque, it usually helps if you kind of point your foot. Now, where you may be feeling this, ideally, hopefully we're getting some stuff on the back side of the hip. You may feel it on the outside of the hip. It's possible you also feel some pressure in the front. If you're feeling pinching in the front, it helps if you just kind of lean back a little bit. That'll unflex your hip and it allows us to hit this rotation without quite as much compressive force. So you're going to hold this stretch position for prescribed time. Then what we're going to do, the PAILS and RAILS are going to be our isometric loading. The first isometric you're going to do is you're going to contract the outer hip muscles to try to externally rotate that hip. So you can think about swiveling your hip into the pressure of your hand. What I like to do to really generate some juice for this is kind of contract my glute, contract my quad, then think about kind of hitting those outside hip muscles, gradually ramp that up to kind of whatever you can do. Just make sure you're giving enough overpressure with your hand that you're not actually moving out of your end range. Once you've hit your prescribed time on that isometric, what you're going to do, you're going to switch now. Now you're going to try to internally rotate your hip even farther into end range. So what that's going to look like is you're going to try to swivel that thigh bone closer to the ground. That knee's going to drop down. You can think about trying to lift off of your hand. You could feel that contraction in your inner thighs, front of your hip, or even outside of your hip. You're going to ramp that contraction up to whatever you can tolerate. You're going to hold it for prescribed time. And then without moving out of your end range, so hopefully you've gained a little bit with that second isometric, you're going to start that sequence over. So you go back to isometric 1 where you're pushing out into your hand for prescribed time, and then you'll try to pull into a little more internal rotation. And you're going to repeat this for the prescribed hold times as well as a prescribed number of rounds that I have you doing. And then when you're done, what I want you to do is just kind of really cautiously come out of it. Your hip's going to probably feel really stiff. You may just give yourself a few kind of rotations here just to get blood flow going back into the joint and kind of ease out of it.